You're transitioning and you're wondering, what should you be eating? This is a question I get fairly often, along with, are there foods that can make me look more femme or more masculine? The simple answer is, no, there aren't. But it makes so much sense that people would wonder how their dietary needs would change as they go through hormone therapy, considering how much messaging we all get about gender being binary and about the needs of assigned female at birth people and assigned male at birth people being so distinct from each other, even though we have all seen there is a ton of body diversity under these two umbrellas. Because there are so many differences from body to body, I encourage all of my clients to build the skill of deferring to themselves for guidance on what and how much to eat. And yes, your body can also do that. Beyond that, to date, there are no special dietary needs identified for people transitioning or getting hormone therapy. Healthy eating guidelines for somebody getting hormone therapy and who isn't diagnosed with a nutrition-related illness are exactly the same as for everyone else. And I bet you already know what they are. Let your vegetables be the star of your plate. Choose a variety of colors of veggies. And don't forget about beans, peas, and lentils. Eat whole fruit, meaning skip the apple juice, just eat the apple. Go for whole grains that your great-great-great-grandparents would have recognized. And if you're drawing a blank on what those might be, just check the post in the description below. And protein is also part of a healthy, balanced diet, but virtually everybody's getting plenty of those. So just remember, vegetables are the star of the plate. That's what nobody seems to really be emphasizing. You already know the general principles for eating well. Where things get tricky is implementing these in real life. On limited time or limited resources, you might find yourself resorting to meals that don't have the balance you were hoping for. The good news is your body does not require perfection from you. Your goal is to do the best you can with what you have access to. What makes the biggest difference is your pattern over time. What you do at one meal is not going to make or break you. So just take a step back and look at your life and your resources. How much time do you have for shopping and cooking? How comfortable are you in the kitchen? Do you need to be budget conscious? Take all of these things into consideration and build an eating pattern that feels sustainable for you. Is this something you can do over the long term? Something you can do through very stressful periods? If hormone therapy is part of your gender affirmation journey, you probably are going to experience body composition changes. If you're on testosterone blockers and getting estrogen, you might see an increase in body fat around your hips and thighs and your chest. And if you're on testosterone therapy, you may notice your muscle mass going up and a little bit of a drop in body fat. Now, to what extent that is going to be true will depend on your individual body. Learning to rely on what your body is telling you is so crucial because your body gives you the best information about what and how much to eat in real time. A lot of people compare transitioning to a second puberty. And if you remember the first one, it was a wild ride, and you probably remember appetite changes, being hungry. While you aren't growing exponentially like you were when you went through your first puberty, you may still notice appetite changes. Follow your hunger cues and eat until you're satisfied. I know this can be easier said than done, since most of us have been trained for years to ignore or bypass what our body is saying. And that's why I'm going to cover letting the body take the lead in eating in the next video. Even if you're perfectly in tune with your body, changes in weight is a normal part of transition. Now, this can be a challenge because weight change can be triggering for anybody who has ever struggled with disordered eating in the past. And this is a very common problem among gender expansive people, gender nonconforming people, trans people, for multiple reasons. Being under additional stress because you have to deal with stigma, bigotry, discrimination, having to do the extra work of assuring your safety, going through periods of poor food access thanks to workplace discrimination. All of that can destabilize your relationship with food. That is not an all-inclusive list, but another thing to remember is how much pressure it puts on us, on everyone. The fact that the rigid cishet rules about what is femme and what is masculine has gendered fatness, leading a lot of people to severely restrict their calories in an effort to fit into very rigid binary gender boxes. The truth is that masculine folks and femme folks come in all shapes and sizes. These are not our rules. You get to decide what masculinity, femininity, being non-binary, being agender, what that looks like to you and on your individual body. Non-binary people do not owe anyone androgyny. Men do not owe anyone high muscle definition and low body fat. Some men have hips, some men are curvy. Not all men have a six-pack. There are no prerequisites for you claiming your true gender expression. Releasing rigid body rules and releasing the binary overall can be an important part of starting to build a neutral relationship with your weight. This isn't something that can happen overnight, and weight changes that come with hormone therapy can be very stressful. If you start to notice that your weight changes are really bothering you or freaking you out, it could be helpful to add an affirming dietitian to your care team. Gender affirmation is a very personal journey, and there is no one-size-fits-all approach to self-care. But there are some things that can be helpful to virtually everybody undergoing medical gender affirmation. With wellness, it's never all about the food, but food can be supportive of all your other self-care work. So while you're remembering to keep those vegetables at the center of your plate, don't forget to get plenty of rest, prioritize your emotional well-being, connect with supportive people, and especially with other people that are farther ahead in their gender affirmation journey. Be patient with yourself and the process, giving yourself all the rest and all the care that you can along the way. I'm celebrating with you as you take this big step in embracing your authenticity. Keep looking within for guidance and keep on trusting yourself.